हाँ सर, मोबाइल से तो होना चाहिए। He joined via mobile, so does it require any audio video permission?
I'm also on mobile only.
हाँ हाँ, I
So am
think
I,
if you
yeah.
can exit the meeting once.
So
Dr.
maybe you could
Nargesh,
try
if you
and
could please exit once and then join again, probably that will help.
rejoin.
मैं वही पूछ रही हूँ, can he hear us? I'm on chat with him.
Oh, okay. Ask him if he can hear us. Yes, that will
Yeah,
at least we'll know if he's there or not.
I have sent all the messages. We are trying to speak here. So he said,
Okay.
okay, he's joining again.
ठीक.
So you have to leave the meeting, sir. Okay. I think he's able to hear us, but बिकॉज उनका ना वीडियो का जो हमारे में आता है ना कि माइक है ना, वीडियो आइकन
हाँ
आता है ना, पर हिज
हाँ.
वीडियो वाज नॉट देयर, ओनली माइक वाज देयर,
अच्छा.
एंड दैट टू वाज नॉन फंक्शनल टाइप्स दिख रहा था बिकॉज ही जॉइंड अनम्यूटेड, सो आई थॉट कि
उतना सब technically I think Deepti would be able to help.
लेट्स सी इफ ही जॉइंस अगेन.
Sammy will have to see if he's using his camera for any other application. Because if he's
Currently,
using
no.
his camera for any other application, this camera won't work.
How will he share a PPT, or maybe he's not sharing
Nahi,
PPT?
so he cannot use the same camera in two apps, no?
Absolutely. Yeah.
मैं बताती हूँ.
अभी उनसे
हाँ.
हाँ आ गए.
अब आ
Hi
Good
गया,
evening,
sir.
sir.
अब आ गया.
So now we can see you and we can hear you
So
clearly.
happy to have the audio visual.
Yeah.
Yeah.
Sir, good evening, sir.
Good
Sir,
evening, ma'am.
will you be presenting a PPT, or it will be just a talk?
So it's a PPT, but it's available on my WhatsApp. So I can share my screen.
So then, no, sir. You, Dipti, will it be possible?
Sorry? Oh, yes.
नहीं नहीं
No,
sir.
Sammy, he can send it to you and you can then
Sir,
share the
actually,
screen.
we want your video also while you are sharing your PPT. But when you do it with mobile,
Mhm.
so your video will get switched on. So I think you can try once. Let's see if it
So
works.
let me share the. Uh, uh,
Yeah. Otherwise, you can share with us, and you can always
no, I'm
prompt
sharing
with
with
the
you as
next
well.
slide.
I'm sharing with you as
Sir.
well.
Let
Okay.
him do both at the same time. Yeah? He shares it with you and then he can start his. अगर वो नहीं होता है, then you can run it. That he
Yes, I have to get ready to download it in my laptop.
You don't have to download no Sammy तो directly भी कर सकती है. Just switch on your WhatsApp on
वो
the
पता
thing
है,
है.
there are a lot
मुश्किल
of
होता है.
things. नहीं नहीं, I am limited in my capacity to use my screen, so a lot of things get
Okay.
shared, and then getting full screen mode, तब तक वो बहुत कुछ.
So I have shared
ठीक
my
जाना.
this.
हाँ sir, I'm downloading it.
The thing is, how I can share this.
हाँ
Sir,
सर, उसमें भी शेयर स्क्रीन आएगा आपको ऑप्शन.
आजकल WhatsApp पे शेयर ऑन स्क्रीन का ऑप्शन
Yes,
आता है.
yes, आता है. But
sir अगर
you,
आप need
WhatsApp must have taken you to the Zoom. So in Zoom, you have to share. There is an option in mobile also in Zoom to share.
yeah.
हाँ.
Actually sir आपके on your Zoom itself जहाँ पे आप हो वहाँ
Okay.
पे आप देखेंगे तो there is one share option नीचे. आप वो share
Share
को
option I have.
हाँ sir
Share.
keep your presentation open first. जो
Okay.
आपका presentation है वो open रखिए पहले. उसके बाद
Okay.
come to Zoom, share, and then you will see the presentation and select it, sir.
So first I'm going. I have just opened my PPT and I'm now
Okay,
back
sir.
on my Zoom.
Share.
And
Go to share, sir.
share I'm there. Share
हाँ
screen.
अब शेयर में दिख रहा है कहाँ पे. हाँ शेयर स्क्रीन करके है वो दिख रहा होगा आपका प्रेजेंटेशन.
Yes.
Full
Start
screen लेना
broadcast.
था.
हाँ
हाँ.
just click on that, sir.
Yeah.
Right, perfect. Now your presentation should be visible, sir.
Is visible now?
No, sir. Abhi, we are
No,
seeing the
sir.
list. You have not opened your presentation.
You have to open your
Yes.
presentation.
Yes, we
Yes,
can
sir.
see.
Perfect.
First slide, if you click, sir, we can see three
Yeah, basically this is the thing. This
That's
ठीक है
that's
mobile.
how you will be
thank you
sharing. Okay, so let me, shall I try once? Because we want one slide
हाँ
at a
you do
time
it
because
Sammy
uh, let
sir
me.
you stop share कर दीजिए sir आप
Okay, okay.
I can do that. I have done that. So
thank you sir
yeah.
now Sammy will share sir it'll be easier sir then so Sammy I'm admitting everyone
Sir,
in
you have to, can you see the slide, everyone? Sir,
Sorry.
can you see?
Yes, we can see the
Can,
slide, Sammy.
sir, can
I
you,
can see it
Dr.
Sammy तो
Nagesh,
भी
can
full
you
screen
see the
कर दे
Yeah,
slide?
yeah, I can
हाँ
see. I
हाँ
can see. I can see.
Sir, it's moving also. So you only give me a
yeah
hint to
Yeah, that's
go to
great.
the next slide.
You make my
I will.
presentation very easy now.
Sir. Then your hands free. You only say, give me a prompt of saying next. So I'll stop now. And once I have invited you,
Yeah.
then we start. Okay, sir?
Okay. Done.
Yeah.
admitting everyone in Sammy now thank you sir
Yes.
Okay.
That's Brinda, sir. She
oh
hosts the
hello sir
meeting from Chennai
Okay, ma'am.
for us. She is there with Down Syndrome Federation of India. And we as DSPS, part of Delhi chapter of DSFI.
Okay,
So
ma'am.
that's the composition. And we also have our president, Dr. Surekha Ramachandran. She might join during the PPT. So
right
on behalf of parents, she will ask most of the many questions because she's been counseling parents from 4 decades now, more than 4 decades now, and
Okay.
a lot of parents she has come
Oh,
across.
please say me. I don't have much answer. Okay.
No, no, sir. She will only ask about the orthopedic issues, and I'm sure you have the
I'm a level.
great capacity
Yeah.
to,
Yeah.
yeah, yes. So we are also live on YouTube, sir.
Okay, ma'am.
We will share this link with you later so that if you require it
Okay.
for your
Yeah.
reference. So, yeah, we'll just take few minutes, wait for many to join. Brinda, if you get to see anybody from the neighboring Asia Pacific country, so do let us know in the chat
yeah
or
sure
whatever.
no so no one has come so far so if they come
That's what I'm saying.
I'll
If they
keep you
come,
informed
yeah. So I'm expecting the most of the parents who have registered for our games, they will be joining.
So currently, how many parents are there? The
Sir,
13 right now.
we are 13 and one is coming now. So, yeah,
so
take care.
many of our parents who
Good
are not
evening,
able to
Acha.
join here see the session and on YouTube so
Yeah,
that's why this helps
Yeah, that's it. And sometimes some parents are busy and they can't join and in live, then they can say.
so, yeah. So it's already
Sammy would you like to
5:07.
start
I
the
should
meeting
start. Yeah, I think I should start.
I
Thank you so much, Brinda. So, thank you everyone for joining. I am मैं पारुल की दोस्त Sammy, and because of some personal reasons, Parul is not able to join. But we are very happy to have an expert who comes from the same area we belong, so will be able to cover in Hindi English for us. So that will not be a problem. So once again, thank you everyone for joining and welcome in today's session. And as parents, we understand that it is so important to know about the problems the problem areas or the challenging areas which we might encounter, because we are trying to equip our champions with a lot of skills, and sports happen to be one of them. And also in light of our coming event, Asia Pacific Down Syndrome Games, the session becomes all the more important, because there are certain criteria in participation in that form, that we have to have an orthopedic clearance for our champs. So we, as parents, we come to that understanding that with the diagnosis of Down syndrome, they developing certain orthopedic condition is, they have higher chances of having it. So, such as they do have some anatomical, problems like flat feet, or ligament laxity, and also hypotonia. So treatment may involve non-surgical approaches and physical therapy and surgical approaches. So, knowing, identifying them at the right time, assessing them for same, and getting the problems treated if any intervention is required is becomes more important to really improve the health and function of the individuals with Down syndrome. So, in the same spirit, to address such issues and know about them in detail, or we have any queries to solve them, we have with us our expert, and for that, we really want to thank India Academic Pediatrician IAP Delhi, West Delhi, because through them, we are coming across many experts who are very skilled in their own specializations, and they readily come for our sessions. So, in that connection, we have with us Dr. Nargesh Agarwal, and he's a distinguished pediatric orthopedic consultant at Child Orthocare Center in Delhi, and he's recognized for his exemplary academic achievements and efficient patient care. And soon he's going to, celebrate his silver jubilee of practice, I guess. So it's been many years for him to be caring for patients, or as a pediatrician, giving care as an orthopedic expert. And he's skilled and specialized in identifying, managing, and treating a variety of congenital conditions also related to this area. So he has worked in many known hospitals of metro cities. He is currently managing the Child Ortho Care Center, a place where his entire dedicated team provides specialized orthopedic treatments for infant, children, and adolescents. He is also associated with many renowned hospitals in the Delhi NCR region, and we are very glad to have him among us. We know his OPDs are mostly overloaded with people seeking his guidance and assistance in their healthcare. Thank you so much, Dr. Nagesh, for coming to this session. And we, all the parents, are waiting to hear from your experience and knowledge, and learn how to manage the orthopedic concerns or challenges in the persons of life of the persons of Down syndrome. So, very warm welcome to you, sir. Over to you.
So, good evening, everyone. Myself, Dr. Nargesh Agarwal. I'm pediatric orthopedic surgeon. So here we are to discuss about the orthopedic problems in Down syndrome children. So Down syndrome, as we all know, the main problem with the Down syndrome children is the hypotonia, the ligamentum laxity. The ligamentum laxity may cause many problems, including the spinal issues, including foot issue, patella issue, hip issue. So many issues they usually face. So main prime issue is the hypotonia, ligamentum laxity. For that, most morbid condition that we can encounter with the Down syndrome is this atlantoaxial joint, the C1, C2 joint instability may lead to some serious issues that we need to take care immediately, and the regular monitoring is more important in this case. Scoliosis, pes planus, DDH, patellar instability, these are different other reasons that we usually encounter. Almost 20% of the children with the Down syndrome has orthopedic issues. So next slide, please. So the spinal issues, mostly the atlantoaxial instability, is the most significant concern caused by the lack of the instability. Uh, Scoliosis is another reason that causes, if left untreated, may lead to permanent deformity. So we have to take care of the atlantoaxial joint most, because nowadays the sports activities we are promoting with the Down syndrome cases, it's very good initiative as well. But at the same time, we have to take care of the atlantoaxial joint. We have to go for the regular monitoring and take proper history. If child is asymptomatic, then you should take precautions, and you should improve the muscle tone with regular exercises and physiotherapy. If your child is symptomatic, then you have to take care of the atlantoaxial joint. If it is required any intervention, then you should go for it. Next slide, please. So hip and knee issue, like hip dysplasia, because of the ligamentum laxity, sometimes the acetabular angle may increase because of the hip is not stable in the joint. But it is very unlikely if child is active and physically sound. Then this kind of the problem is although rare, but we should always check for the hip instability as well. Patella instability is also not common, but yes, it can present in the Down syndrome cases. It may lead to the dislocation of the patella, subluxation of the patella, or may cause the anterior knee pain, or it may cause the limping in the child. So we should look after this patella instability as well. Regarding the SCFE, slip capital femoral epiphysis, it is a very a rare condition, but it may lead to the hip pain around the pain in the groin area. And the typical history with this kind of the problem is child had an history of this trivial fall. Like there's an history that my child just had a fall, just a fall at the home, and leading to the pain in the hip area. Most of the time, the age group of this kind of the problem is around 10 to 12 years, and may lead to the pain in the groin area. And it requires immediate intervention because you can't leave the SKP as such. Next, please. And foot ankle issues like pes planus, like flat foot, hallux valgus, the thumb is going outward direction. Metatarsal adductus means this foot is turning inside. So these are the common issues that we usually encountered in the flat foot, this Down syndrome cases. Next slide, please. Next slide, please. The management is basically monitoring is more important. Orthosis, usually we ask parents to use the orthosis accordingly. If child is having the flat foot, we can give them arch support, SMO orthosis. If required, the AFO we can give. And in case of the patella instability, we can ask them to use the patella stability braces, and we can ask them to do regular physiotherapy, vastus medialis obliquus, and the quadriceps strengthening exercises. Or surgery is only indicated in the severe cases like ischemia, like atlantoaxial joint instability leading to the symptoms like pain, numbness, weakness in the upper limb. And the one more thing I want to highlight in this Down syndrome cases, because the surgery should be taken, should be managed, because anesthesia is a big challenge, because the child may lead to the sleep apnea, or anesthetic risk should be considered before going for the surgery. Next slide, please. Next. Atlantoaxial joint is 10 to 30% of the individual with the Down syndrome may experience this kind of the instability. Mostly remains asymptomatic. Regular monitoring and history taking in exercise is important. And 1 to 2% cases may lead to spinal cord compression, may lead to the weakness, numbness, and this muscle weakness, and may require surgical intervention. Next case.
Yeah.
Next, please.
Yes, sir.
Obviously, the cause is ligamentum laxity or the odontoid dysplasia. Odontoid dysplasia means odontoid is dense, is not properly developed, or the malformation is there. in the cases of the Down syndrome, or maybe because of the collagen defect. Next, please. The classification of this is different. Aplasia means complete absence of the dens. Hypoplasia is both are rare, but the most common is the os odontoides. It means persistent ossiculum terminal may lead to the instability. Next, please. X-rays are usually sufficient to diagnose the atlantoaxial this instability in the open mouth X-ray, odontoid X-ray, cross table X-ray, dynamic flexion and extension X-rays. So recently, one child came to me to take clearance for this sports activity. So I asked them to get these kind of the X-rays. In this X-rays, we usually take some measurement. This next slide, please. This is the atlantodental interval, which is basically the distance between the back of this atlas to the odontal process. This is the atlantodental interval. It should not be more than 5 millimeter. If it is more than that, it suggests some kind of the instability. Next, please. This is the space available for the cord. Is a SAC score. If the SAC score is basically the back of the odontal process till the spinous process, the distances should not be less than 13 millimeter. If it is less than 13 millimeter, and there is a risk of the instability is high. And one more, this rule of third. Next slide, please. Steele's rule of third is that there should be 1/3 space should be 1/3 for the cord, 1/3 for the dens, and 1/3 is the free area. So this is the rule of third. If this rule is okay, then child is perfectly fine, and you can give clearance for the sports activity under guidance. Next slide, please. So management is basically obviously the regular checkup, avoidance of the contact sports, especially if and the ADI is more than 5 millimeter. Usually the conservative treatment is sufficient in asymptomatic cases like cervical collar, strengthening exercises, rest. Surgery is only advised for the symptomatic cases like fusion of the C1, C2 vertebra. Next slide, please. Patellar stability, usually the MPFL and ligament reconstruction in severe cases, painful cases, or complete dislocation cases. Usually, we start with the conservative treatment first, with the strengthening exercises of the vastus medialis obliquus, quadriceps muscles, and patella stabilization braces. Next slide, please. Skiffy, we have already discussed. Skiffy is basically it's kind of the immediate surgery is required because we can't let the skippy as such. It may lead to the further damage to the hip joint, may lead to the vascular necrosis. Next slide, please. Scoliosis, we usually start with the braces, exercises, yoga, and regular monitoring. In severe cases where we see the corpse angle is very high, it may lead to the permanent deformity. In that case, we ask them for the surgery. Next slide, please. This paraspinous is the flat foot. Usually, it's very common in the Down syndrome because of the low muscle tone. Again, the braces, exercises, and SMO orthosis is recommended. Surgery is usually not recommended for the flat foot cases, especially in the Down syndrome cases. Next slide, please. So take-home message is basically we should promote the child for the regular exercises, ask them to take a regular monitoring, proper history, and especially look for the atlantoaxial joint because this is the most common, most morbid conditions which will lead to the weakness for the muscles. Thank you.
So that was a very, very time-bound presentation, and I think major concern you have only covered. And we request parents, if you have any questions with our expert, please raise your hand, or you can also put your question in chat box. We will take it up.
Yeah, ma'am. I want to ask something.
Okay. Okay. What is your name? I
मोनिका
can't see you. I can't see you
मैम वीडियो
because
चालू करती हूँ
until unless you raise hand, I can't locate. Yes, Monica. हाँ जी, पूछिए. Yes.
मैम सर मेरी गुड़िया 7 ईयर की है और उसके साथ 2 बार फ्रैक्चर हो चुके हैं और एक बार है ना मसल से स्ट्रेच हो गई थी थेरेपी के दौरान। तो उससे क्या है कि सर उसका चलने में थोड़ी सी दिक्कत आ रही है।
जी देखिए, फ्रैक्चर होना कोई डाउन सिंड्रोम में फ्रैक्चर होना कोई ऐसा नहीं है कि वो ऐसे रीजन हो सकता है। ये डाउन सिंड्रोम
हाँ
इसमें ज्यादा फ्रैक्चर होना ऐसा नहीं होता कि डाउन सिंड्रोम इस वजह से ज्यादा फ्रैक्चर हो रहा है।
नहीं सर इस वजह से नहीं हुआ, वो थेरेपी के दौरान थेरेपिस्ट से हो गया था सर।
दूसरा, थेरेपी का मतलब ओवर स्ट्रेचिंग नहीं होता।
हाँ
यूजुअली मोस्ट ऑफ द थेरेपिस्ट जो करते हैं वो सबसे बड़ी मिस्टेक क्या करते हैं कि दे यूज फुल फोर्स। ओके,
यस
फोर्स जो है, मेरी ताकत और बच्चे की ताकत में डिफरेंस है। ठीक है,
डिफरेंस
तो
होता है।
हमें उस चीज को कंसीडर करते हुए तभी स्ट्रेचिंग करनी चाहिए। नेवर यूज ओवर फोर्स। ओके, हम मान लो बच्चा एक पर्टिकुलर मूवमेंट पे आके रजिस्ट कर रहा है, तो गिव
हम्म
सम टाइम। ओके, लेट द मसल जो है उसको वहां तक रिलैक्स होने दीजिए, देन थोड़ा सा 5 to 10 डिग्री और बढ़ाइए, फिर रुकिए, फिर 5 to 10 डिग्री बढ़ाइए, फिर रुकिए। कभी
फिर
भी
उसके
एकदम ऑल ऑफ सडन कभी नहीं करना चाहिए। ऑल ऑफ
हम्म
सडन करोगे तो मसल ट्रॉमा हो सकता है, और जैसे भी आपने बोला कि आपके बच्चे को भी हुआ, और इट मे लीड टू मेनी पेशेंट, स्पेशली सेरेब्रल पाल्सी केसेस। मेरे पास सेरेब्रल पाल्सी केसेस बहुत आते हैं। सेरेब्रल पाल्सी
अच्छा
केसेस में सबसे बड़ी मिस्टेक जो हमारे साथ होती है, stretching. So we should
हम्म
not focus on the stretching more. We should focus on the balancing. Okay,
बैलेंसिंग हाँ
बैलेंसिंग पे ज्यादा फोकस करना चाहिए, गेट ट्रेनिंग पे ज्यादा फोकस करना चाहिए, और मसल कोऑर्डिनेशन पे ज्यादा वर्क करना चाहिए। ठीक है,
यस सर।
तो वो ज्यादा इंपॉर्टेंट होता है रादर स्ट्रेचिंग। और स्ट्रेचिंग करिए, मैं मना नहीं कर रहा, बट स्ट्रेचिंग जब भी करें ऑल ऑफ सडन ना करें, और ग्रेजुअल ग्रेजुअल करें।
तो सर
ठीक है।
उसके स्पेशल शूज बनवाए हुए हैं जयपुर से,
हम्म।
तो वो स्पेशल शूज सही रहे हैं क्या सर, वो पहना
नहीं,
सकते हैं
स्पेशल
उसको?
शूज में क्या बनवाया है? फ्लैट फुट के रिगार्डिंग एएफओ बनवाया है कि
हाँ
एसएमओ
सर ये
बनवाया है?
एंकल एंकल तक बनवाए हैं सर।
एंकल तक ही है ना, तो वो एसएमओ
यस सर।
ऑर्थोसिस हुआ है। मतलब एसएमओ ऑर्थोसिस फ्लैट फुट के केसेस में, स्पेशली डाउन सिंड्रोम में हम रिकमेंड करते हैं, जिससे
हम्म
क्या होता है, एंकल मोटिस जो है थोड़ा सा स्टेबल होता है, तो उसे देने में
हाँ
कोई दिक्कत नहीं है। आप वो कंटिन्यू कीजिए, बट है ना, केवल वही दे दिया वो सफिशिएंट नहीं होगा। एट द सेम टाइम आपको मसल कोऑर्डिनेशन और स्ट्रेंथनिंग पे फोकस करना होगा। ठीक है,
अच्छा
तो मसल कोऑर्डिनेशन और स्ट्रेंथनिंग इज मोर इम्पोर्टेंट देन स्ट्रेचिंग।
अच्छा।
ओके, तो स्ट्रेचिंग से ज्यादा स्ट्रेंथनिंग और कोऑर्डिनेशन पे वर्क कीजिए।
तो ये सर कौन डॉक्टर ही बताएंगे ये तो?
हाँ हाँ, ऑक्यूपेशनल थेरेपिस्ट जो आपके फिजियोथेरेपिस्ट की जगह आप ऑक्यूपेशनल थेरेपिस्ट से ज्यादा करिए।
हाँ ओटीसी ही करवा रहे हैं सर, ऑक्यूपेशन थेरेपिस्ट से ही करवा रहे हैं।
और उनसे बोलिए कि थोड़ा सा स्ट्रेचिंग कम और स्ट्रेंथनिंग और कोऑर्डिनेशन एक्टिविटीज पे थोड़ा फोकस करें।
ठीक है सर, थैंक यू सो मच।
ध्यान रखें मोनिका, है ना?
यस
That's
मैम।
why meeting an expert who has more experience and knows how much pressure to be given of what age of the child is more important. So, sir, there's a question in the chat box. I would like to read
Hello,
it for
sir. My
everyone.
son is
हाँ,
3.5 year old. His backbone is not straight
not straight.
when
हाँ.
he is sit in the backbone and bend. Sitting time can be massage on back. Yes, मसाज कर सकते हैं, मसाज करने में कोई दिक्कत नहीं है, मसाज इज ओके, बट बच्चे को प्रमोट कीजिए कि वो सीधा बैठे। सबसे पहले हमारा जो सिटिंग पोस्चर है वो शुरू से ही बच्चे को सही से ट्रेन करने की कोशिश कीजिए। हम एज ए रूटीन जब बैठते हैं, एज ए जनरल, मैं एज ए जनरल बात कर लेता हूँ सबसे पहले। हम सभी जब बैठते हैं बिल्कुल इस तरह से बैठते हैं, अपने बैक को पीछे की तरफ पुश करके। तो कोशिश कीजिए कि आप अपने बैक बैक को आगे की तरफ कीजिए। सो ट्राई टू सिट इन अ प्रॉपर पोजीशन विद योर especially the tummy side spine. The lumbar spine should be in the forward position. Okay, so if you see the spine from the side, there is a two curvature, two up in forward direction, there is the convex, and two in the backward direction, that is the convexity. So convexity is basically to in the dorsal spine, and the concavity in the cervical spine in the lumbar spine. So to maintain the concavity, you should sit straight. If you sit in a your spine in the bend position, the convexity will happen. So for that, you can massage, no issue. Massaging is not a big issue, but at the same time, you should teach your child to sit in a proper position to avoid the permanent deformity.
Yeah. So I hope that is answered. So that generally we have seen the big toe of the children, our children, is going outwards. But there's a one picture shared by the parent in the chat box only. She says that the toe is not straight and it's slightly bent inward.
So this is the hallux valgus. Hallux valgus is basically this happens because of the ligamentum laxity. Okay, so for that you can use toe separators or hallux valgus splint. Okay, hallux valgus splint is easily available on internet on digital market. Or the same thing at the same time you can do some exercises. If I can show you some exercises like.
So,
You can use a rubber band. Okay, suppose this is the rubber band and your child thumb is basically turning in that way. Okay, your child thumb is turning in that way.
okay.
Okay, so what you can do, uh, you can use a rubber band like a band that you use in your making your
Pony.
pony.
Yeah.
So what you can use the thumb like then do the stretching exercises. Okay.
Yeah.
And the first time you use the single band, and after some time you can use the double band, and then gradually you can increase the strength. This is known as the hallux valgus exercises. You can easily check on YouTube. Hallux valgus exercises. I can write down in this as well.
Yeah, sir. Yeah, sir. So, sir, that because it's the foot, so that rubber band has to be in the both the big toes of
Both
the
of both.
child,
Yes.
and then we are trying to tell the child that pull your foot towards outside so that
Yes. Yes.
the
Yes.
toe, or they can rest on heel and do that.
Like standing on the toes will improve the
Yeah.
muscles of this foot, and walking on
Okay.
the toes
Okay.
and walking on the outer part of the sole. These are exercises for the flat foot exercise. I can share you one exercise link that is my own exercise technique. One second.
Ji. So you'll be sharing in the chat box.
Yeah, chat
right?
box. So
Yeah.
this is basically for the flat foot exercises. You
Yeah.
can
Dhanalakshmi, and for all the parents, sir is sharing in the chat box. Please save those messages if um, uh, uh, because for later use, this chat will not be available for on our YouTube. So please,
this is basically the
Ha.
exercise chat.
Yeah.
And this is available in Hindi only.
Okay, no worries. So I think by visual also it can be. Is it?
Yes, by
So
visual.
we have Dr. Selvi. She has raised hand. Dr. Selvi, can you unmute and ask your question, please?
Yeah, ma'am. Good
Yeah,
evening,
please.
sir. I am from Jharkhand. My daughter is 15 years, and when she was around 10 years, she used to run very speed. When gradually she stopped that running, and in between on the age of 13, she was unable to walk even for 20 days. I don't know what happened. Suddenly, she stopped walking, and then she was bedridden also for 20 days. Then again, gradually, her movement started, and then walking, everything happened. Now she is very normal, and she's going ortho, and she is doing threadmilling. Whether she can do threadmilling for 5 to 10 minutes in a slow speed?
Yes, yes, she can. But have you checked the atlantoaxial joint?
No, right now, after that, we have not checked recently. Past 2 years, I have not checked. I will check, sir. Now she's going for the sports.
I recommend you to check because the child has already gone through the one episode of the bedridden things. And maybe some neurological issue happened, which was ignored and recovered by God grace. So I would advise you to this atlantoaxial joint to get checked. Okay.
Okay.
So regarding the treadmill walking, it is in fact very good for the child, but to improve the muscle tone, especially for the lower limb, it will reduce the weight of the child. It will increase the physical and the social and mental stamina of the child. So it is good.
So another, sir, in the OT there, I'm making her to climb for sometimes in the vertical staircase, and then some balancing exercise. So that things it can be.
Yes. See, under the guidance, under the supervision, you can promote your child to increase the physical activity. Okay. So any kind of the physical activity which is under the supervision In fact,
Mhm.
nowadays, as the madam Nunbi, now we are promoting the Down syndrome cases for the sports activity.
Mhm.
Okay,
Yeah, yeah.
so sports activities can be done only when the child is comfortable with a regular routine physical activity, like
Yeah, yeah, yeah.
like standing independently, walking stair or climbing stairs, downstairs. So
Yes, sir.
first make the child comfortable with normal physical activities, but
Yes,
start
sir.
with the normal under supervision.
Yes, sir. Yes, sir. Yes, sir. Thank you, sir.
Thank you, Dr. Silvi, for asking that question for the good of everyone. So, there are a number of things listed by one parent. If you can suggest some
Yes.
solutions for it,
Yes.
sir.
So basically,
He
suggest
said,
some solution for the
yeah.
sitting
So we
posture.
will read, we will
Yeah,
read it.
definitely.
I will read it loud so
Yeah.
that like, so the parent has asked for solutions for first sitting posture. She sits sideways. Second, closes her one ear. Third, always eats in a spoon. Fourth, sleeps in a frog position. Five, when we try posture correction, she does not cooperate. Six, attention span is less. So, sir, whatever comes to your expertise, please
So
answer.
basically, more or less, things are habitual part. Okay.
Yeah.
So regarding the frog position, you should get checked your hip joint. Okay. If your child hip joint, knee joint, and ankle joint is perfectly fine, then nothing to worry. It is just a habit of the child. You can let the child sleep whatever the comfort position of the child is having, and you can promote to improve the posture slowly, gradually. Don't force. Sometimes what we do, we force them, and they irritate, and they do it by intention. Okay, to gain the attention. Okay, so don't force the child, and you can improve gradually, slowly, and with like pampering them a lot. And regarding the sitting posture, obviously the same thing. You should ask them to improve the posture gradually, and you can use some pillows, or you can use some braces, posture correction braces. You can use. But what is the age of your child right now?
Sridhar, are you there? If you can unmute and mention the age of the child, please.
Yeah, yeah, I'm very much there. I'm listening.
Yeah. Yeah, Sridhar.
Her age is, yeah, her age is 25.
The child is 25-year-old, so you can use the posture correction belt, which is
Okay.
the internet. Okay.
Ve- Very
So
good. Okay.
her 1 year, I don't think so. It is my part. You can check with them, you know, and
Okay. Okay.
Yeah.
mm,
Yes, for attention span and always covers one ear, so that you have to get
as the
checked with the
in the door.
ENT or
Okay. Okay. Thank you. Thank
yeah,
you.
yeah. Thank you so much. So the next query says that my daughter is 8 months old and currently visiting OT for early intervention. How early it is okay to scan for ortho issues? What's the right time you recommend?
So basically, see, ortho issues, especially the atlantoaxial joint, doesn't come so early. Okay, so especially if the child is not able to sit, because the atlantoaxial joint subluxation happens when the child shake the neck suddenly, or there is some trauma. Okay, so it is although very rare, but we should check atlantoaxial joint around 2 or year or so. Okay. Regarding the hip joint, if your pediatrician has checked clinically, then there is no need of X-rays for the hip. Hip issues usually happen when your pediatricians see the asymmetrical thigh fold, limb length discrepancy, or uh, like thinning of the calf muscle, or any issues that is unusual to your child. Okay, only then you can meet your orthopedic specialist nearby. And regarding patella instability is not common in 8-month-old child. Pes planus is not common in the child. So I think you should continue with the early intervention with the occupational therapist. Any issue related to the hip joint that I have already mentioned, that asymmetrical thigh fold and limb length issues, then you definitely meet your orthopedic doctor.
Yeah. So, rest regarding, flat foot or gait or, those non-surgical intervention, that will be done by OT, sir, right?
Yes, OT and flat foot is when the child started walking. Your child is just 8 months
Then,
now.
yeah,
When your child
yeah,
started walking, then you can meet your nearby orthopedic surgeon.
yeah. So, Rahul, I think you have noted the important times when he said 2 to 2.5 years for Atlanto XL. I think that is the time when you have to be little more
So at that time,
alert.
the child started standing and doing activities.
Yeah,
At that time, you should.
yeah, yeah. Then later. So, okay. So, Sir has mentioned about the Hallis valgus splint. So that was to be used for that inward toe. And another question came, our children generally sit and walk in a bending posture. So how can we improve that? Even by continuous command, it's only for a minute or so, like, they tend to straighten and then.
Yeah, basically this is a habitual part, and because of the low muscle tone, you can go for the this regular occupational therapy. Again, I've already mentioned that you can use the posture correction belt uh, uh, initially to improve to make the habit to break the habit. Initially, you can use the posture correction belt and occupational therapy, muscle strengthening exercises. It will definitely give you a good improvement. Okay.
Then it is my daughter is 18 years old. Any food supplements required for bone health?
See, basically, muscle and ligament are made up of protein, and bone is made up of calcium. So, what do you need to give for the muscles? High protein diet. High protein, like you can use egg, soya bean, pulses, okay, paneer, okay, sprouts, broccoli, ragi, and if you are non-vegetarian, you can use as per your custom and ethics allow you. So give whatever the possible. So most important is avoid junk food. So most of the children they use they eat junk food. So I ask them to avoid junk food and regular food which is available at regular Indian kitchen is good, and mix it with the good protein, good calcium. Like custard apple is good in calcium, okay, and chestnut is good in calcium, okay. Um Makhana is good in calcium.
Yeah.
Banana is good in calcium, okay. Uh, Ragi, okay, and chana is good in calcium, okay. So you can use dietary supplement and supplements in medicine point of view. You can take calcium syrup but not for a long duration, okay.
Yeah.
If you want to take calcium tablet or syrup, take it for 2 months or 3 months, then take a break of like 15-20 days a month, then you can restart it. So better to promote physical activity, good diet, good physical activity, and high protein and calcium diet.
Yeah.
One
So
more thing,
food, yeah, sir.
calcium absorption is more dependent on vitamin D. If you are giving good calcium, but your child is deficient in vitamin D, that calcium
Yes.
will not absorb. Okay. So supplement your child with the vitamin D or expose
Yeah.
your child to the sunlight. Okay.
Mm.
So at least 30 minutes in a day, anytime. It is very confusing things. Should I expose to
Yeah.
the child in the morning?
Early morning. Yes.
So whenever the time suits you, expose your child to the sun. Okay,
Yeah.
during that time, uh, skin should be exposed as much as possible.
Yeah.
Means like chest part and back part and the upper limb, lower limb, whatever the maximum possible exposure you can give to your body, and your body should be you can apply this vitamin E rich oil like almond oil, olive oil,
Yes.
the coconut oil you can use
Yeah.
to that is good for you.
Yes. So, yes, there are a lot of vitamin deficiencies our children face, and D happens to be one of them. So that is, I think, one reason that calcium, even if the calcium-rich diet they are having, but their body is not able. So yes, food habits are more important because we have found, sir, that it is difficult for our children to unlearn habits. So when they are young, let's have in their plate a lot of food supplements already, so that they are in habit of taking that. So, sir, we just talked about the toes, and here's another picture on the chat. It says,
Yes.
my daughter's toes are a little crooked. I think those are the toes we can see which are, to outwards, the big toes. And what exercises would be good for correct or supporting this kind of a
So
toes alignment?
this is basically it's a peculiar deformity
Yeah.
in the Down syndrome cases. The increased gap between two toes, especially the first and second toes. So usually it is just a part of this problem, and usually doesn't cause um, any issue or any deformity or any disability to the child. You can leave it as such. Mostly is insignificant, asymptomatic, only cosmetic issue. So
Yeah.
I don't think so. Any intervention is needed for this.
Yeah. Okay, so that is the advice to Shampa. So, sir, regarding calcium and supplement, and about vitamin D, you have suggested that this particular parent says that their pediatrician has suggested to stop calcium supplement at the age of 6 months of the child. That time they were giving also pan D. Is there any supplement you suggest for the 8-month-old child
See,
for good bone health?
usually I defer calcium supplementation before the age of 1 year, if until unless your child is having rickets or severe calcium deficiency. Usually, especially in the first 6 months, we always promote parents to give a mother feed, okay, and ask mother to take good supplements, okay, because if mother is taking good supplement like good calcium, good vitamin D, and good, any other mineral supplements, this supplements usually go through the breast milk to the child. This is sufficient. Usually, we ask parents to give vitamin D because vitamin D is one of the vitamin D which is, as the man already mentioned, this deficient in the Indian scenario. So I never ask parents to take calcium, especially in first 1 year of age, until
Yeah.
they are calcium deficient. You can give
Yes.
them vitamin D supplement, but not calcium.
Yeah. So the parent also says, I think they have the twins, and this is one child they are talking about with DS. So they say that breast milk is not sufficient for them.
See, usually this is our thinking. The breast milk, you should promote as much as you can, or you can use the top feed as well. Nowadays, the powder milk is available, which is already fortified with the supplements. Okay, so you can add vitamin D, but don't add calcium until unless there is a clinical indication like rickets.
Yeah. So Rahul, he gives the thumbs up. So any calcium and vitamin D supplement for 2.3 years old child, sir? Would you
So
like to?
vitamin D, usually I always stress for the vitamin D only. I give calcium until unless there's a rickets, okay, or a severe calcium deficiency.
Yeah.
Because in Indian kitchen, calcium is easily available. Okay, so you can supplement the banana, makhana, this sprouts, ragi, broccoli, chestnut, this custard apple, and many other things. Although at this age, most of the child are fuzzy, they don't want to eat.
Proceed.
But
Yes.
if you feel the child is not eating well, then you can supplement with your child with the calcium. Any calcium brand, all brands are same. Nothing specific to give this brand or this brand. I think some of the parents mentioned Osopandi. You can give the Osopandi is okay, but at the age of this 2.3 years, you can give your child around 5 ml once in a day for 2 months, then stop for some time, and then you can start after some time. And regarding the vitamin D, usually the daily dose of the vitamin D is the 800 IU, which is recommended. And nowadays, the supplements, the formulation available in the market is 1 ml is equal to the 800 IU. Any formulation, any company you can use. Many companies are giving 1 ml is equal to the 800 IU. You can give 800 IU once in a day, and you can give it for a longer duration, like 6 months or so. Okay, because this
Yeah.
is the regular dose of the vitamin D. It will not cause any toxicity or like high dose.
Yeah. So yes, we really appreciate the experts who talks about the natural way of enriching your life or your child's life, where like sunlight very important, and yes, diet control, or the maximum food in diet, which supplements, which we think can be like. So again, calcium and vitamin D related, that do we have to give vitamin D with calcium tablets if the person with Down syndrome is having calcium tablets?
So again, I'm saying you, if your child clinically okay, there is no sign of calcium deficiency, there is no sign of the rickets, there is no need to give calcium. Okay, only supplement your child with the uh, vitamin D. Okay, or until unless your child is fuzzy, is not eating well, like just I have already mentioned that give good calcium and good uh, protein diet like makhana, banana, sprouts, broccoli, ragi. Okay, so chestnut, this custard apple, they are good in calcium, and Indian kitchen has sufficient amount of the calcium supplementation in their diet.
Yes, yes.
So you supplement your child with the vitamin D. 1 ml is equal to the 800 IU once in a day for longer duration, maybe 6 months or so. If you feel your child is very fuzzy, not eating anything, then you can give your child calcium for some time, like 2 3 months, or any company 5 ml once in a day, like for some time. But don't give calcium in under the age of 1 year. You can give vitamin D.
Yeah. So one question is received in a personal chat. It says, can you suggest anything for the knocking knees or elbows?
Knocking in knees is basically because of the calcium deficiency. Okay, knock knee is more common, especially one more thing I want to mention in this. Knock knee is common in especially 4 to 6 years of age. When the child born in first 2 year of the life, bow legs is very common. Okay, bow legs means the knees are apart and ankles are touching. Okay, and the knock knees means the knees are touching and ankles are apart. In first 2 year of the life, physiological bow legs is very common. I used to see around 3 to 4 child every day. My child is having bow leg, my child is having knock knee. So just first 2 year of the life, bow legs. Bow legs means knees are apart and ankles are touching. In first 2 year of life, bow legs is normal or physiological until unless there is a calcium deficiency. And 3 to 4 years or 5 years or 6 years, knock knee means knees are touching and ankles are apart is normal until unless there is a calcium deficiency. If these problems, bow legs are persisting after the age of 7 8 years, or knock knee is persisting after the age of 10 years, is considered pathological and we need some surgical intervention. Oh, and regarding surgical intervention, surgery is very successful and it is almost 100% curable, especially knock knee and bow legs. So first you see what is your child age is, and if your child is really having any deficiency or not. If child is having deficiency, then you need to take care of the deficiency first, and then regular physical activity, exercises, sun exposure, good diet, and regular checkup. If your child is beyond the acceptable range, means your child is having bow legs and is more than 7 years of old age, then may
Yeah.
consider for surgery. If child is
Yeah.
having age is more than 9 or 10 years, then can consider surgery.
Okay. So any child who is beyond 10 should seek the orthopedic advice and, go ahead with whatever suggested there. Right, sir?
Yes.
Yeah. So another question just popped up in the chat that my child is 7 year having alopecia areata. One of pediatrics suggested calcium. Is it helpful in?
So
Is
I can
calcium helpful in alopecia?
the alopecia is the basic skin problem. It's not my issue, so I can't
Yeah.
give you an answer for
So yes, it's a wrong session to ask the question about
ask
this.
your pediatrician or skin specialist regarding the same.
Yeah. Yeah. So, any other question? We still have parents joining the session, which is very encouraging. But any other question, parents, you want to ask?
Yeah, hello,
Sir,
ma'am.
yes, who's
Sorry.
this? Please raise hand so that I can see you right up on the top. Yeah. Yes. Neha, yeah, I think question just got answered.
Arvind.
Neha, unmute.
No, actually, one more query I have. Actually,
Please ask.
my baby is 2.3 years old, and
Yeah.
right now he started walking for 15-20 steps. So I'm doing physiotherapy on regular basis, but right now, yesterday physiotherapist says that there is some problem in his left leg. So not in the bone, but he's using right leg most probably, but he's not using left leg much. So should I go for the examination or
Yes, yes. You should, if the child is creating the preference before the age of 4 years or 3 years, and you should consult to your orthopedic doctor, because if child is having some muscle issue or bone issue, it should be diagnosed, intervene as soon as possible. So if your occupational therapist is suggesting some issue, then you should consult with your orthopedic doctor.
Yeah, but I asked him should I go to the orthopedic pediatric? So he told me that it will be okay after some time. This is not related to the bone, but still I'm worried. Can I show you if it is it okay? He's with me.
Neha, Acha, will you be able to see Dr. Nargesh if she shows you right now the
Clinic is in
child?
Model Town, Delhi. So if you're nearby, then
Yeah.
meet me.
Neha, where are you based? आप कहाँ रहते हो?
But yeah, I'm staying in Delhi, but right now I'm not in Delhi. I'm in my in-laws' house. It's in Bihar.
No worries, Neha. I think the child
Initially,
is at a
meet nearby the
tendency.
orthopedic doctor, and whenever you come to Delhi, you can meet me. No issue.
Yeah. And having a consultation is not a problem. Don't advance with a doubt in mind. So if you have a doubt, you'll not be able to give full, attention to your child. So just have a word with a consultation, verbal consultation with an orthopedic doctor. Maybe clinical checkup will give you some, solace. And whenever you come to Delhi, do meet sir. Okay, we will circulate. If you require his location, we will give you. Yes, Anupam, you unmuted and you raised hand. You want to ask?
Yeah, hello doctor, hello Smita ma'am.
Yeah.
So
Hi.
my son is 7 year plus old, and he has something challenging to running fast. Can say the speedy walk is can say for his running. So what should we do for that? Any suggestions, sir?
Um, uh,
Running. He avoids
Yeah.
running. This is what you want to ask, Anupam?
Yeah.
He
Actually,
he
he
can
is not
go brisk.
comfortable in fast running. So he try his best, but the speed walk in normal child
Brisk
can
walking.
say
Yeah.
this is his speed running
Yeah.
can say.
So running,
So
I think he wants to say that he avoids running. He can brisk walk
and
when is asked to run.
during the running, his posture is also in down shape,
Okay, he
upward down
bends
shape.
forward.
Yeah,
Yeah.
yeah, yeah,
Yeah.
yeah.
means the muscle tone is less, and
Yes,
you should
can
go for the regular physiotherapy and occupational therapy. It will help you out. Okay, running is not an issue. You should first promote him to coordinate well with all the maximum possibilities. So don't force him to run. Sometimes child get irritated by this. Okay, and as promote them, like you run, child will see you and he'll always encourage to run. Okay, so you can ask your occupational therapist to work on the muscle coordinated core muscle strengthening. So core muscles are important for the balancing and the strengthening and gait training. And gradually with the occupational therapy, things will improve. And don't force your child for the running. I think
Yeah.
most of the time parents need to do exercises, and the child usually see the parents and
Yeah. Mirror. Yeah.
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 So
So
we never
Anupam, it's
try.
time for you to put on your running shoes and run
Yeah,
so that he can
definitely,
catch you.
definitely.
Run with
Yeah,
his chocolate or whatever he
yeah,
likes.
yeah. So we never force him, but he more excited to run. So we
Yes.
generally
And
stop him so he don't get injured or
uh,
anyway. So
yeah.
we worry
That's
about that. But
yeah.
my child is excited to run, so
Yeah.
we stop it. Yeah.
So we can support with a
And
muscle strengthening, Anupam. You want to ask something more?
yeah, same challenges for jumping. Yeah. So he's struggling for jumping and height,
Excuse me, ma'am.
for height.
One emergency is my clinic. Can you give me 2 minutes, please?
Yes,
Ji sir,
sure,
please,
sure, sure.
please, please, please,
Please
sir.
take your time. Yes, thank you.
So this also
So,
happens when we extract our experts from their OPD times that, he's in his clinic, he's in his center, and
okay,
the center is
mm,
active, and
okay.
suddenly
So
this
where,
has happened.
so
Yeah.
ma'am, can we have appointment if we require in future to connect this
For
doctor? Yeah.
for Anupam, sir, Anupam, for this particular doctor,
Yeah, yeah.
we'll be able to give you the location. Sir already
Yeah,
mentioned. I will once again read it out for all of you.
yeah.
That
That will be helpful
he,
so that
Hanji, Hanji.
if get chance
He's in
to,
Delhi, Hanji.
so
Yeah.
he can in
And
his
you can
supervision he
Google
can
also
physically
his
examine.
name. Yeah.
Okay, okay,
Child Ortho Care. The center he runs is the name with Child Ortho Care. And
okay,
it is at uh, C7 D Park, Model Town 3,
okay.
New Delhi. So you can search for it on Google, or Child Ortho Care with the doctor's name, Dr. Nargesh Agarwal. It will also give you location of Sir's center.
Okay,
I'm
okay.
sorry, it is
Yeah.
some.
It's okay, sir. No
Yeah.
problem.
Sir, do you need to go? Because we have, I think, one or two questions in the
No,
chat. That is.
please go through.
Yeah. So it says 5.3 years old male child, foot flaring inwards along with flat feet, normal for DS kids, or can orthotics foot support be helpful in earliest? Some doctors say it's normal for the children with Down syndrome, no intervention needed. Some parents and therapists say it needs to be, intervened. Sir.
So basically, I have seen the pictures as well. They have sent the pictures on the chat box.
No, no, sir. Yes, sir. Yes, sir. Arvind has
So,
sent.
so it's
Yeah.
the same problem. That is basically a widening of the gap between first and second toe, which is just a cosmetic issue. You should focus on the flat foot, and flat foot required exercises that the exercise have already sent on the link have already sent. So
Yeah.
basically, the toe that is I can see. One second, please.
Sir, please, sir.
So
The left
basically,
feet comes inward more. This
yeah.
is what he's
So
saying.
basically, for that, they can go for the exercises that I have mentioned in my chat box. It will
Yeah.
definitely help them.
Yeah. Arvind, you have to go up in the chat before we close the meeting so that you can, uh, note down the technical term for that particular this thing. So again, Sridhar wants to ask that please tell us on some routine prevention medical checks that you feel mandatory on periodical basis in regards to orthopedics.
Some routine prevention medical checkups.
Yeah, or yearly basis or.
So first is basically atlantoaxial joint is most important than anything else. So basically,
Yeah.
rest things are manageable. They can be easily picked up. The first most morbid and disastrous is the atlantoaxial joint, and you
Yeah.
should meet your nearby orthopedic doctor, your spine doctor, or nearby any specialist who deal with the
Yeah.
Down. Go for the atlantoaxial joint instability, especially if your child is having any pain, numbness in upper limb, or walking difficulty.
Yeah. So muscle strengthening basically for other things is more important to improve posture or,
Yes.
and all. Yeah. So I am posting, sir, this hallux valgus splint you said, and exercises related to hallux valgus, right?
Yeah.
Yeah. So that is what you have to search for, Arvind. So, as presented, I suggest you, acha, that is a suggestion. So need to drop, but really appreciate, and sir, thank you, sir. I think that is the question up till now, and we really appreciate your consideration for giving us time in your busy schedule also, and it was really a good discussion with you, and now you are in our link, and many parents are also going to visit you, and we are going to travel you more for such sessions, sir.
Nice.
Thank you so much, Dr. Nagesh. A very, very
Thank you, ma'am.
yeah, warm regards to you, and I think you can resume your OPD now.
Thank you.
Yeah, yeah. Thank you. Thank you, parents, for joining. And yes, if required in future, we will definitely call sir again and keep practicing for the coming Asia Pacific Down Syndrome Games. And we will meet you there. And of course, next Saturday. Thank you so much. I will end the meeting now.